The next question is, we'll be looking at our own immunity. People forget that actually keeping ourselves strong and healthy, getting good rest, eating healthily, and maybe supplementing our diet with appropriate vitamins and minerals, these things can all help us to keep ourselves strong. That and our emotional well-being as well. And if we're wearing ourselves down, if we're getting drained, if we're unnecessarily anxious, and we do know there's lots of things to be a little bit worried about at the moment, particularly if a loved one is unwell, these things can wear down our immune system. So everybody may have heard about taking a bit more vitamin D or taking some zinc. That this may help in your immunity. But what else could people think about doing? Denise, would you like to go first?
Yeah, I mean, there's a range of ways in which people can look after their immunity and make sure they're protecting themselves. And I think at the moment it's something that they absolutely should definitely be making sure that they do cover. I mean, one of the main things to actually do to improve immunity is, if somebody's a smoker, is to stop smoking. Has an enormous beneficial effect on their immune system. So that we'd always recommend that people seek advice to stop smoking. They can do that through our local services, through the council website. There's links for that. But also, as you've mentioned, a healthy, balanced diet is really important. Lots of fruit and vegetables to make sure we're getting the vitamins and the minerals. Regular physical activity is hugely important. Also helps with well-being as well, but it's getting out there, getting moving and active really does have a beneficial effect on the immune system. Other issues to consider is if people tend to be quite heavy alcohol drinkers, is to reduce their alcohol intake. That can also improve their ability to fight off viruses and bacterial infections. And I think a really crucial one, I know can be really difficult for someone with caring responsibilities, and that is to actually ensure that they're getting enough sleep. And I think it's really important that if they can, to really prioritise making sure that their sleep is something that they're getting enough of, and it gets topped up when they need to, and they're getting a good portion of long rest or unbroken rest whenever they can. And the main one as well, I think, is about minimising stress. I think if people can make sure that they're building in time for their own well-being, that keeps their resilience up and charges them to deal with whatever they face. And that can be a whole host of issues that come their way kind of throughout their daily lives. But also that's exactly the same when it comes to fighting infections. If they minimise their own stress, it enables the system to better respond if they're facing a bacterial or viral infection.
Thank you, Denise. Tim, would you like to add anything to that?
Thanks, Brendan. I think that Denise has given a really full response, but the only thing is that personally, from my own experience as well, sleep is absolutely critical, and it's very easy to get overtired. So I think that the other issue really we're seeing is that there's a growth in young people having mental health difficulties, a wide range of descriptions. So we'd really encourage people to keep talking to other people and to seek help if they need to. Actually, sometimes it's just a friend who you can call and have a conversation with. And we all know that actually those relationships are really important. So whilst we can't keep them up always in person, actually the phone call, the FaceTime, the Zoom call makes a huge difference. So really encourage people to keep going with.
Thank you, Tim. I think one thing I'd add to this is reaching out, as you've just said. You can contact us at the centre, you can talk through your problems, and you can bring a lot more perspective. Sometimes as well, carers of whatever age don't like to talk about their own needs. They think they should come second. They are devoted to the needs of their spouse or their family member or their brother or whoever it is that they're caring for. And dwelling on their own needs, they feel that's a little bit selfish. Actually, it's really important, particularly when the stresses and pressures people are under, to have the space and the time to know there's someone you can turn to. If it's in your own family, that's great. If it's your own networks, your own school, or your own neighborhood, or on the phone to a member of your family. But if you can't turn to those people, you don't want to reveal your vulnerability, but you wouldn't mind talking to someone in the strictest of confidence, then you can always contact us. The phone number is available to you, and we can help and be there to support. We know what it's like being a carer. I'm a carer myself, and sometimes just having someone to have a few words with can be a great assistance. Lastly, we do run courses which can still be provided via the internet. And one or two carers have come back to us after they've done some of the relaxation courses and the other courses that we provide about planning for the future. And so it's been quite transformative. And actually, they've been able to let go of a lot of stress and anxiety that they didn't realize they'd built up. Thank you.